Okay, what I'm going to teach you guys today is a self-mobilization / manipulation technique. This is good if you're having some mid-back pain, even a little bit of lower back pain, and you're just kind of feeling stuck. I personally like to do this one right before I go golfing or even when I go running. So to do this technique, it's helpful to have a towel or anything that you're not going to rip apart. What you're going to do is just grab the towel and you're going to place it kind of right across your sternum, okay? You want to make sure that you're sitting up nice and tall, make sure the shoulders are down and back. And what I'd like you to do is put some tension through the towel, and then what you're going to do is you can find what side you are restricted on. So this side, I go to about there, and then this side, you can see that I don't go as far. So what we're going to do is we're going to manipulate that to my right. So tension across the towel, go until you feel some restriction. Here, you're going to come out an inch, and then you're gonna rotate. And you wanna make sure that you're rotating at the thorax when you do this. It's also good to note, I didn't wind up. So when I came all the way here, I came at about 2 to 3 inches. I didn't wind up and then go for it. You want to find that restriction, come out, and then push it. And then now you'll see, I can actually go further than I did before. If you get to your end range and you're feeling any sort of pain, stop and don't do the technique. Okay, next what I want to teach you guys is using some of your own body resistance to help stabilize the thoracic spine. This technique is challenging because it's often difficult for patients to kind of understand what I'm asking, because you actually have to use co-contraction, meaning you're actually resisting your own body movements. So when I go to rotate, for example, one side relaxes, allowing me to rotate towards the opposite side. So with this particular technique, you actually have to slow yourself down and make it labored. One way to demonstrate that would be is actually if you're flexing your biceps, okay? So when you flex your biceps, you have to contract both the biceps and the triceps in order to maintain this position and actually flex the muscle. When you do this, though, if you were to let go, obviously you'd either do that or you would do that. So to demonstrate what I'm asking you to do, so you get a feel for it, is that flex your biceps, for example. Now maintaining tension on the biceps, you're going to slowly allow yourself out but resist that motion. That is basically what I'm asking for. It's a co-contraction of the triceps and the biceps, but the biceps resisting that triceps motion. So you can actually localize to a specific segment when you're trying to stabilize the spine, especially thoracic spine or even lower down. So to do this technique, what you're going to do is you're going to take your towel, again, kind of bring it right across the the sternum. And then what I want you to do is put some tension, shoulder blades down and locked, feet flat on the floor. And then what you can do is then rotate. We're going to start to the right, my right, but you're going to resist yourself from the left, but allowing the movement to the right. So holding here, tension across your towel, hold here, and then you're going to rotate, but make it difficult for yourself. And if you're doing it right, you can actually feel almost every segment as those little stabilizers kind of start to kick on. So you're going to be here, and then labored rotation to where you feel a segment. Once you get to a segment, you're like, ooh, I can feel a little bit of shaking. Weak muscles, especially the stabilizers, will start to jog or shake a little bit. And that's how you know, especially if it's around the place that you've been having some difficulty, that you can actually move through that segment and then kind of bounce on it, kind of just back and forth. You could even do a little bit of side bending. But what you're doing is making all of your motions labored. Here, and you can go the opposite way. Find a segment that kind of shakes a little bit and kind of rotate back and forth. This is one of those techniques that actually takes a little bit of practice. It takes a little bit of awareness, kind of what you're feeling, and you're going to have to play with it a little bit to get some of the desired results. But if you pay attention kind of to where you're having your pain along the spine, you can actually localize some of those little spinal stabilizers. So yeah, it's a great one to do at the office or even when you're just sitting and watching TV. If anything hurts, obviously stop. Okay, let's talk about a little bit of localization of some of those smaller paraspinal muscles, especially in the upper thoracic spine. I'm going to go back to use the old trusty cat and camel exercise, but with kind of a little bit of a different focus. Patients have a tendency to kind of move very globally. What I'm asking you guys to do is actually focus specifically on that area that you're having pain, okay? That's the segment you really want to pay attention to, because that's the segment that needs the spinal stabilizers to kind of kick on, because the inflammatory process, they start to shut down. When I do my manipulations, that helps improve the movement, and it takes away what's impinging the joint, but it then leaves the muscles a little bit in a weakened state, in a less sensitive state. So it's difficult for them to work to continue to stabilize that segment so it doesn't get jammed up again. So I'm going to show you guys a bit of a cat-camel technique with a little bit of a different focus on that specific segment. So you can do this from all fours. From here, okay. What I want you to do when you get into the all four position, just kind of close your eyes for a second and just take stock of like where you actually are feeling that discomfort, okay? That is going to be the hinge point. That's the point where you want to kind of move through and focus on, so you know you're getting those specific segments. So take a second, couple breaths, and then just really kind of localize and check in with that spot, because that's where you're aiming for. So from this position, what I'd like you to do is then you're just going to move into the angry cat position. Think about every single segment just doing its job. And then kind of find where you're having symptoms. So right about here is where I'm going to say I'm having some symptoms, kind of right at about my mid-back, almost between the shoulder blades. And then you can just kind of move through this. And it's probably difficult to see on the video, but I'm hinging just through that specific segment. So I'm not doing the full arch up, and I'm not dropping all the way down. So from this position, you can actually find that specific segment and not only do your kind of angry cat and then move back into the camel, you can even do a little bit of side bending on it and just rotate. So now I'm actually moving this way. I'm shortening this side and lengthening the other. And you can kind of move through that segment and know that you're targeting those muscles. Conversely, you can also move down into the camel position. And again, as you sink down, find where that segment starts to contribute and kick in. And from the extended position, the spinal extended position, you can kind of come up and down just a little bit, so you know you're moving through that specific segment. All the time you're keeping your mind on that segment. And even from here, you can actually do a little bit of side bending. So I'm side bending here in that extended position, so you know that you're getting that segment. It takes a little bit of practice. It's not easy. You really do have to focus on that. It's not one of those exercises that's just like immediately gratifying, like you're moving all sorts of weight. So you're going to need a little bit of patience, you know, while you're doing that. And kind of feel like those segments and move from there. Okay, so I'm going to teach you another kind of like localization, stabilization exercise that I think will be helpful in order to help you kind of start to localize some of those spinal stabilizers that need rehabilitation. So what I'm going to do is I'm going to use this bench, but you could actually do this on a kitchen countertop. That works just as well. Back of a chair. I mean, it's nicer to have something that doesn't quite move, at least easily. That way you can kind of put a little bit of body weight into it. So let me show you this technique. What you're going to do from this particular position, let's just say it's a kitchen counter, you're going to bring yourself down into kind of extension. So you have a little bit, or bring your thoracic spine down to extension, moving kind of through the sternum. And you want to find that segment where you can kind of feel it start to move, the one that's kind of bugging you. And from here, in this position, you can do your kind of cat and camel. Kind of oscillate on that. It's a little bit easier to side bend, so you can see me kind of shortening that right side. And again, find that segment through the full range, move all the way through it till you find, you know, you feel that segment, and then you can kind of bounce on that just a little bit. Just kind of localizing those muscles right at that segment. It's faint. If you're a little bit more symptomatic, you might feel it just a smidge more. But again, none of this should be causing any sort of pain. And you just want to bounce through it this way. Conversely, you can also do a little bit of rotation. So I'm actually bringing and rotating my rib cage back and forth. So you can kind of rotate down and rotate the opposite way. And with the rotation, depending on which way you're going, you can kind of figure out, you can kind of see, you know, where that segment lies. You're going to feel maybe a little bit of shaking, and then you can kind of just rotate kind of back and forth just right through that segment. So if you're feeling it here, you can rotate kind of right through it, so that way you know you're localizing some of those muscles that you need. This is also good, again, if you have something that doesn't move. You can do even a little bit of traction technique. You can even do a stretch where you can kind of just, again, imagine that painful segment, draw a line straight through the body, and then as you come down, you know, think about trying to move through that segment. So that's a nice little way that you can start to play with it. Again, these are not immediately gratifying exercises. It's not like moving a weight. So you just really have to be patient and then find those segments and then move again slowly all the way through them, so you know that you're getting those little stabilizers of fire. They're not the biggest muscles in the world, so it's not, like I said, going to be immediately gratifying like pushing weights.